My name is Gabriel Meissner, and this is a special report for RPTV News. Toronto is at the centre of growing protests as the Ontario government moves forward with its plan to close 5 of the city's supervised consumption sites, including the one at Regent Park Community Health Centre. Advocates warn this decision will have devastating consequences, particularly for Indigenous and racialized communities, disproportionately affected by the opioid crisis. More than 180,000 Ontarians will lose emergency health care access when these closures take effect on April 1st. For Regent Park and surrounding downtown east neighborhoods, where harm reduction services are essential, the loss of Regent Park's Community Health Centre's SCS means more than just an increase in overdoses. These sites provide critical health care access, connections to housing and shelter, mental health support, and non-judgmental spaces where people can access life-saving resources. Without them, the most vulnerable residents will be left with nowhere to go, forcing drug use further into public spaces, alleyways, and isolated conditions where the risk of fatal overdoses rise. The urgency of this crisis was made clear at 2 major demonstrations, one on February 20th at Victoria and Dundas, and another on February 25th outside the Ministry of Health. Meanwhile, Ontario's Deputy Premier and Minister of Health, Sylvia Jones, is defending the closures. She cites concerns over public safety, including complaints about discarded needles and disruptive behavior near consumption sites. The province says it will replace these services with 19 new homelessness and addiction recovery treatment hubs, also known as heart hubs. But these will not offer supervised drug or needle exchanges. In the following segments, we'll hear directly from harm reduction advocates at the rallies, as well from Stephanie Mayers, who shares her perspectives on why these closures are a direct threat to people who use drugs and the broader fight for dignity, health, and survival. This is Gabriel Meissner, and you're watching RPTV News.
My name's Stephanie Myers, and I am a former worker at one of these, or of multiple CTSs in Toronto. And I came here today because I've known many service users and community members who have passed away. I can't even tell you how many people have passed away that I know personally. Well over 80 people in the last 5-6 years. I'm currently a case manager, and a lot of my clients use these services at CTSs or SCSs, and I'm really worried about them. Like, if these places close, I can only imagine what's going to happen, and I don't know if I could bear it. And it's a complete injustice that these places are keeping people alive to, if people want to get treatment, and they can. But, these places are keeping people alive, their community, they meet people where they're at, they provide essential services. Like I said, I've worked in multiple of them, so I know the work, I know exactly why people come there and the special services that we provide and the community that the staff and the neighborhood provides to people. It's so important. Yeah, I can't tell you the numbers off the top of my head, but it is pretty severe. I was just telling a friend earlier that there are times in the communities that I work in that we have overdose deaths every week for months, and even multiple times a week for months. If these places close down, those people they're at risk, and I don't want to say people are going to die, because I really hope that they don't, but that's the reality that we're facing. And I personally have reversed overdoses of people that multiple overdoses over years, until people are ready to either get treatment, or people are stable enough to make sure that they're using safely. And those people, if these places didn't exist, those people would very likely be dead at this point. I do know that, for instance, Moss Park CTS posts the numbers of overdoses they respond every month. So they respond to about 30 to 70 overdoses a month. So multiply that by 12 and then multiply that by the amount of sites that are in Toronto and then also across Ontario, and that's thousands of people. And those sometimes that's one person overdosing a few times, but a lot of the time those are individual cases, and I can only imagine like each one of those overdoses is a potential for either death or severe brain injury, and people need that support on their journey through life, through their journey dealing with whatever they need to deal with. And yeah, so there's, I would say, like thousands of people a year across Ontario. And we know now that I think it's 11 now a day in Ontario are dying from preventable overdose deaths. And that's with CTSs existing. So without them, it's just going to be far worse.
Just this morning, seeing someone deceased, not even 2 blocks from my home. This crisis has claimed 2 members of my family and countless friends. As the drug poisoning crisis claims numerous lives every single day, the Ford government removing scientifically proven health services like safe consumption sites, and there's zero consultation with Indigenous communities.
People who use substances can care for themselves. They are their own leaders. They have their own solutions, and they save lives more than any first responder, harm reduction worker, and anyone else. And we are the experts, and we are the people who use drugs, and we are the members of our community who live in our community who are going to be supporting them in that fight, in that legal fight. So like I said, none of this comes at the hands of the state. Every bit of justice that Indigenous people have had, including Indigenous people who use drugs and substances, has come because we have fought this country every step of the way, and this is no different. So, miigwech for everyone for being here today. Miigwech for everyone for listening. Nahau, miigwech.
So I also want to highlight that this is a joint effort across many, many cities. So today, in Barrie, in Guelph, in Hamilton, in Ottawa, in Timmins, and here in Toronto, people are taking to the streets to demand justice for their communities. We keep us safe. I also want to acknowledge that as of March 1st, these are the sites that are slated to be closed. So, you just heard our sister here talk about Haymops and Kensington Market. They are responsible for the legal challenge against the province. They are slated to be closed. Toronto Public Health, the works, slated to be closed. Parkdale Poon West, across the street from my own house, slated to be closed. Regent Park, Bevel Up, slated to be closed. South Riverdale, slated to be closed. We know that these sites have saved thousands of lives. Every 2.5 hours in the province of Ontario, someone dies from a toxic drug supply. This is shameful. We must keep our voices. We must keep using our voices, and we must support people in our community who use drugs, who ultimately, as we heard our sister say, are going to be responsible for keeping themselves safe. Harm reduction is for drug users, by drug users. Harm reduction and safe consumption sites are rooted in evidence. It is a healthcare matter. This is our healthcare. Drug users are under attack! Drug users are under attack!
I'm here today because we are in a toxic drug crisis, an overdose epidemic which has taken the lives of too many people in this province, including too many that I have cared for. In this time of crisis, we need to be doing everything we can do to save lives and support people. We need easily accessible detoxes, rehab, counseling, medications, primary care, and we need to keep people alive. consumption sites do. We lose one person every 2.5 hours in Ontario to an overdose. And the Ford government counts on us not caring about people who use drugs and people who die as a result of cruel policies. Shame. But I'm here today not only as a family doctor, I'm here first and foremost as a mother. I cannot even begin to imagine the pain of the loss of a child to an overdose, an entirely preventable occurrence. I refuse to let my children be used as a political pawn to harm people who use drugs. We're here to promise all mothers, all parents, and all the loved ones of people who have lost someone to an overdose that we will do everything in our power to fight like hell and keep people alive. We know from so much research that these sites work. A study out of the Lancet showed a 67% reduction in overdose deaths in the area around Toronto supervised consumption sites after they opened. 67% reduction in deaths. That is an incredible statistic for anything in healthcare. But instead of applauding these life-saving services, instead of expanding these life-saving services, the Ford government is shutting down 10 supervised consumption sites across the province and barring new services from providing life-saving needle distribution services. These sites often provide what the rest of society does not, a safe haven, a place where you're treated with compassion, dignity, and humanity, and where not only do people help keep you alive, they also help you find whatever you need: wound care, counseling, housing, and so much more.
We keep us safe! Who keeps us safe? We keep us safe! Who keeps us safe? We keep us safe! Who keeps us safe?
We keep us safe!
Who keeps us safe?
We keep us safe!
But now, Guelph, Hamilton, Kitchener-Waterloo, Thunder Bay, Toronto, and Ottawa will see their sites closed.
Shame!
And these communities are terrified of what will come next. Health providers are terrified we are turning back the clock to a time before needle exchange, where HIV and hepatitis C rates will skyrocket, and 911 calls and ER visits will further clog our already overburdened system. Business owners are worried about having to respond to overdoses in washrooms and hallways. Parents like myself are concerned that we'll see our community members suffering in the streets and being pushed to unsafe situations like parks and washrooms. And of course, people who use drugs have been through this all. They feel once again that their lives don't matter and that they are disposable. So we are here together outside the Ministry of Health to say no to Premier Ford and Minister Sylvia Jones's cruel policies. We are coming together today with vigils in 6 cities across Ontario: Hamilton, Ottawa, Guelph, Barrie, Timmins, and Toronto, to say we will not take this lying down. We need our supervised consumption sites. So say it with me: save our sites!
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 This government has chosen to demonize harm reduction, when harm reduction is what we do every day in healthcare. Harm reduction is treating high blood pressure to prevent a stroke. Harm reduction is providing pap smears to prevent cervical cancer. And harm reduction is providing trained staff to supervise drug consumption to prevent overdose death. We know the science, we know the real life stories. Supervised consumption sites save lives, and they keep all of us safer. We will not allow Ford to pit harm reduction against the rest of healthcare. Remember this on Election Day, and every day before, and every day after. We are not going away until we see this cruel decision reversed. We want to save our sites!
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 Hi, my name is Miss Wasson. I'm a Dene and Cree woman. My family is from Salt River First Nation, and I'm a resident here in Toronto. I'm a member of Toronto Indigenous Harm Reduction, and I also work at an overdose prevention site. I'm witness to the toxic drug supply claiming the lives of our friends and relatives, and the human suffering and the dehumanization of drug users. The closures of safe consumption sites is a death sentence for thousands of us and our loved ones. Over the past 4 years alone, Toronto safe consumption sites have responded to over 10,000 overdoses. And every 2.5 hours, we lose a community member to the toxic drug supply in Ontario. Safe consumption sites have provided thousands of referrals to life-saving supports. Harm reduction was created by drug users for drug users. Harm reduction is an evidence-based practice rooted in autonomy over our bodies and our love for one another. The closures of safe consumption sites, a decision by the provincial Conservative government, is archaic and rooted in purity politics. The very philosophy of harm reduction is a threat to the state because it is the acknowledgement that we are in control of our own lives. We've said no more dead sisters. Indigenous people are overrepresented in the death toll by the toxic drug supply. We are also the main demographic of people that access safe consumption sites. Our bodies are sacred and our people are sacred. Indigenous people have the right to self-determination in healthcare. It should be up to us how we care for one another. The closure of safe consumption sites is also an attack on the safer opiate supply and compassionate care. The denial of safe supply and compassionate care is social murder. The attempt to dismantle drug user liberation is the legacy of the settler colonial agenda. Our displacement from the land, the poisoning of our waters, and the extraction of the earth and the attempted genocide of our people is continued through the deliberate denial of safe supply and harm reduction. Harm reduction is Indigenous resistance. When we say land back, we also mean our autonomy back. Just as we defend our land and waters, we also defend the people in our own bodies. I'm going to share a quote with you from John Trudell. The drunken Indian is the Indian that saved us. I can't be who I am, and I'm not going to be who you tell me to be, so I'll just be nothing. I'll be something else. I'll just do my time and get through it. I'll erase the pain, and I'll do just what I have to get through it, but I will not become you. As we near the closure of many life-saving safe consumption sites in the city and across the province, I want to acknowledge the strength and the brilliance of people who use drugs. Ultimately, it will be the community and drug users who protect and ensure that the safety of one another. As we embark on this change in our community, it will be important to support those who are doing what they can from within their homes and within the streets to keep each other safe. Thank you.
At the end of all of our meetings, the Harm Reduction Advocacy Collective stands in a circle and takes a moment to acknowledge our lost loved ones to the toxic drug crisis. We ask that you join us here now in calling out the names of the folks that you know that have passed due to the toxic drug poisoning crisis. Feel free to scream their names as we remember them and take a moment to remember why we're here.
So my name is Malika. Thank you for introducing me. I'm an HIV and infectious disease doctor here in Toronto. I've been working with people living with HIV for 10 years now. Many of my patients use drugs, and I'm here to attest to the fact that supervised consumption sites, needle exchange programs, safer supply prescribing, and other harm reduction efforts save lives. They have saved the lives of many of the patients I care for, and I am so grateful. That's why I'm here today in full support of people who use drugs and harm reduction activists who are speaking out against the shutting down of 10 supervised consumption sites across Ontario. This includes The Works, one of the largest sites run by Toronto Public Health. Many of my patients access these services regularly to stay alive. Overdoses related to a toxic drug supply is already a crisis. The Ford government is turning this crisis into a catastrophe to score political points and to satisfy a small number of people who are unwilling to live in community with poor, unhoused people and those who use substances. Rather than targeting the policies that have resulted in a housing crisis, politicians are instead deflecting and targeting people who use drugs and face homelessness, including hiring private investigators to spy on supervised consumption sites in response to the charter challenge being brought against them. The Ontario government, including the health minister, continue to make misleading and unsupported claims about crime rates around supervised consumption sites, when we know that crime rates actually go down. The Ford government's response directly contradicts the wealth of evidence that shows that safer communities are those that are more resourced, not policed or criminalized. Doug Ford repeatedly talks about needles in playgrounds and near daycare, using images of mothers in playgrounds in his commercials to promise shutting down these sites. I am also a mother, and I want to say unequivocally to my children and to all of us here that the lives of people who use drugs are not disposable. We are in community together. We cannot allow people who use drugs to be used as scapegoats to divert the attention of those of us who are housed or don't need to rely on SCSs to use substances. We cannot allow our anger to be redirected. We must demand more from our elected officials to improve living standards, access to affordable food, housing, and community services. Rather than listen to expert evidence and the lived experience of people who use drugs, the Ford government is continuing a long tradition of racist and classist lawmaking that leads to displacement and death. In 1908, the federal government enacted the Opium Act in response to white settlers rioting and burning down Chinese businesses in Vancouver. It was in response to racist and xenophobic settlers that some of our first drug prohibition laws came into place, making it an offense to import, manufacture, possess, or sell opium. Punishments including incarceration and deportation. The disproportionate targeting of racialized people is ongoing, with higher rates of cannabis-related arrests and convictions for poor and racialized people, among so many examples. But what brings me hope is that as long as the racist and colonial drug war has existed, people, especially Indigenous people, racialized migrants, queer and trans people, and poor working class people have fought against the government's attempts to displace or erase them. That is exactly what we are seeing today, just as we saw in 2017, when many of you here and other activists put up the first unsanctioned overdose prevention site in Moss Park. It was community operated for 10 months and pushed the provincial government to expand overdose prevention sites across the province. I am personally grateful for that OPS in Moss Park. It has saved the lives of some patients very dear to me. When I teach medical students, we often talk about the fact that antibiotics only work if people can take them, which means being housed, able to access care without fear of discrimination, stigma, or withdrawal. To that, I will add, all of the HIV treatments, all of the antibiotics, they can only work if people stay alive. To the Ford government, and I think all of us here say, stop killing the people we care about. My hope is this, that these latest attacks by the provincial government only embolden more and more of us who exist within different healthcare and social service organizations to fight against these cuts and to fight for an expansion to overdose prevention sites. Let us not sit by as the government gets away with social murder. Let us make it impossible for them to speak publicly anywhere without being challenged about these cuts. If politicians are lying to the public and enacting public policy that contradicts evidence, it is all of our responsibility to not stay silent. Let us shame them into action if that is what is needed to stop these cuts to life-preserving services. Let's do that in ways big and small. Vote, call your representatives, get out in the streets, join and support the Harm Reduction Advocacy Collection and the Toronto Overdose Prevention Society. This is an emergency and we need healthcare leadership, Toronto Public Health, and all levels of government to intervene now. I hope we see courageous workers, organizers, and institutions open up more sites that are in hospitals, mobile vans, shelters, family health clinics, and everywhere people who use drugs seek support and services. I hope we all commit to taking the overdose crisis seriously and take leadership from people who use drugs, who have always taken leadership in taking care of one another. It is this culture of collective care that we all need to defend and expand in the face of these attacks. Thank you.
My name is Suzanne, and I'm here today representing the Leslieville Harm Reduction Coalition, and we're a group of neighbors that live in Leslieville, and we support and love the safe consumption site in our neighborhood. Woo! We know that this site keeps everyone in our community safe. And as a parent of a young child and a resident of Leslieville, I am petrified of what it's going to mean on April 1st when this site closes. I know what it is going to mean, and it's going to mean that, you know, me and my daughter on our walk to daycare are going to walk past neighbors and friends that we know who are going to be dead. I know it's going to mean that there are going to be overdoses in the Tim Hortons bathroom that we are going to witness. I know it's going to mean that in the parks that we play in, there are going to be needles and other paraphernalia discarded because there's nowhere for people to return them. I know it's going to make my community and my daughter radically less safe, let alone the people in our communities who use drugs and who use these services. This is a terrifying situation. You know, the people in our community who are currently very unsafe are people who are poor and people who use drugs. We talk about lack of safety, but in my community, when I go to some of the parks with my daughter, I have personally witnessed multiple times people who just look poor and are not doing anything wrong being asked to leave, being kicked out, being harassed. And it, as a parent, what makes me the most terrified is to raise my daughter in a world where some people so clearly don't matter, where some lives, some bodies are absolutely disposable. And the closure of these safe consumption sites means that we are raising our kids in a world and teaching them that some bodies, some lives, particularly Black and Indigenous bodies and lives, absolutely don't matter. And that is a terrifying, slippery slope. And I refuse to raise my child, or just be a person who lives in that world. So I'm so glad to see us all here today, rallying together to save these sites, and harm reduction saves lives.
Will we fight? 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 Will we fight?
Don't forget to like, share, subscribe to our YouTube channel, and visit us on all our social media platforms. Please visit our website for more information.